It's crowded, it's controversial, but most importantly for its patients, the Family Health Clinic in Hamilton is free. And this is what's attracting registered patients by the hundreds.
I think at present it's about 6,900 enrolled patients. That means patients who belong to us. But we have got registered casual patients also, about 12,000 plus now.
Dr. Suresh Vatsyayann started the free service after setting up the Health for All Trust 3 years ago. He says it was a huge risk for a passion to help the poor that's worked out quite well.
Almost 40% of the public cannot actually afford to go to a doctor. Certainly not twice in a week or 10 days, and certainly not with 5 kids. It's almost impossible.
Many patients who've switched over for the free service say the family clinic has made a difference to their lives.
For us to go to the doctor, it's $40, $50 somewhere else, and we don't have that week to week if you're on a benefit. So.
But I like it. The service here is really good. Same as last doctor I went to in town, it cost me $50 for 2 minutes.
Although he's the only registered doctor in the clinic, Dr. Vatsyayann says he's able to handle the huge workload because of his dedication and assistance from unregistered trainee doctors who are helping out while waiting for their registration papers.
Like taking history, doing examination, and we consult him for the treatment part, and he tells a lot many things, and we learn a lot over here.
However, there are some who don't understand how it all works.
Oh, it's the first time I've heard of a free clinic. Yeah, I don't know where they get their funding from, but...
We put this to Dr. Vatsyayann.
If we get about $9 or $10 a patient a month, that's good. You just imagine a patient, the poorer of the poor patients come at least 30 times a year. Every week they are running because they have 5 children, one gets sick, then another gets sick, then another gets sick, and they keep on coming to you. And you divide it by those 20, 30, or let's say even 12 visits, $9 a month. That means not even $1 a month. I don't think that's enough for any practice to run. By having sheer number of people, those who come to us, we have managed in a way that our subsidy is more than enough to look after us. And the extra services like surgeries which I perform and donations from people look after us well. We should be actually getting about 100,000 a month. We are getting about 50,000 a month at present.
Government subsidies?
Yes.
And that $50,000 a month
is more than enough for us to live.
To provide free services?
Yes.
Dr. Vatsyayann admits government subsidies he receives is enough to run a clinic like this. However, he's not saying no to donations being made to the trust.
I just do it myself. There's a sign over there, donations are welcome.
Oh no, donations have to be there because we have to have so much running expenditure. I'll give you an example. We use the latest technique of cervical smear, the thin prep, which is the equipment itself. We spend about $30, $35 each person. That bottle itself comes out there with gloves and all that stuff. We charge nothing. So somebody has to pay for that. Somebody has to cover for that. And those are the donations which look after us.
Dr. Vatsyayann says the clinic gets around 100,000 in donations a year, which offsets the expenses for cheap minor surgery that patients have access to. It's a formula that some patients think more doctors should adopt.
We've got friends that need to go to doctors and don't go because they can't afford it.
They can't afford it. That's, bottom line is money.
And you can't go to the hospital until you're referred from your doctor. And so, rock and a hard place, it's either this or the emergency clinic. If it's not an emergency, then you go to your doctor.
Yeah.
So,
but
definitely.
No, it is hard. But bottom line, it's money.
Questions posed to the Health Ministry about the clinic's subsidies and operations still remain unanswered. The only comment the Medical Council made was that there's nothing wrong with the kind of service provided here. In the past, some in the medical fraternity have questioned the clinic's operations. Dr. Vatsyayann doesn't want to talk about this, but some of his patients do.
Because they are being threatened by a doctor who's coming in and doing it on a low-cost basis. He's putting the time in, he's working long hours, admittedly, and I think he's doing very well. But you see, a lot of the other doctors, they might start at 9 o'clock and they finish at 5. And I'll tell you what, they charge like scalded cats and they don't offer the service.
You have 2 assistants here as well?
2 more assistants who sit here, yes.
And it's always full?
Always full. So 4 people are seen at a time. And then I move from one room to another room to see patients.
To check on your assistants?
Yeah, and then see the patient, make final diagnosis, give treatment.
And how many patients a day?
About 100, 120 patients a day.
Every day?
Every day.
Dr. Vatsyayann insists he works hard not for the money, but to provide a much-needed service. However, he's candid about the realities of making a living.
Yes. I'm not getting little salary. I'm getting good salary, which every GP should get.
Which is, can I ask you that?
$210,000.
You don't have any qualms about telling people this?
Why would I have? I do a job, I do a work job 24/7. I do so many surgeries. I put in so much effort. And I think every doctor should be paid accordingly.
But he says the clinic hasn't achieved its goal yet.
The future is very simple. We have to have a piece of land. We have to have a building. We will serve by the end of next year 1/5 of Hamilton. By the end of 5 years from today, almost 70% of Hamilton. We want under one umbrella, which will be a National Institute of Primary Health Care, where people from all over the world will come to teach and train, to learn the ways of how the general practice should run. Kickboxing.
These goals sound almost unreal, but this maverick doctor insists more doctors in New Zealand can do this. A good service for free and a good salary to boot.
Looking at the results, okay?
Well, that's all we have time for you this week. You can also watch our program online at www.tvnz.co.nz. Keyword Asia Down Under. Till next time, ka kite anō.